Correspondent William, live from New York for the latest on what's happening in America. And it seems that the situation is quite grim from the figures that we're seeing, the national tally higher than that of the combined tally of China and Italy at this point. The Navy ships, just one of the things that I assume the government is doing at this point.
That is absolutely right. Just looking specifically at New York, according to the figures released on Monday, over 1,200 people have lost their lives. New York's Governor Andrew Cuomo warned that as many as 800 people could potentially die every single day in New York alone when COVID-19 is expected to hit an apex, which could happen in the next couple of weeks here in the state. So that is a huge concern. There are also medical experts here in New York City that are warning that some of the major hospitals here could reach capacity in just a couple of weeks' time as we hit that apex. The way to mitigate that, according to officials, is to try and boost that capacity, especially when it comes to hospital beds, as well as the amount of ventilators that are needed. The state warns that they want around 40,000 of those life-saving ventilators. Now, what are they doing? Well, as you so rightly mentioned, they're trying to boost capacity with the likes of the USNS Comfort ship, this floating hospital with 1,000-bed capacity. That isn't the only type of facility of its kind to try and boost that capacity. We've also seen the Javits Center on the west side of Manhattan. Now, that is an expo center normally used for huge events like New York's annual auto show. That has instead been converted into another field hospital. That has a capacity of nearly 3,000 hospital beds. We've also seen a smaller field hospital set up right in New York's Central Park, that iconic destination. Now, that field hospital has the capacity for over 50 beds. Now, that field hospital, unlike the Javits Center, unlike the USNS Comfort, will be used for critically sick patients that have COVID-19.
Right, absolutely. And William, now many states, of course, have been appealing to the Trump administration for help. They're saying they're running out of masks, ventilators. But it seems that Donald Trump, just up till 2 days ago, didn't want a complete lockdown of the country, even as some estimates and research in America are saying that over the next 4 months, potentially 80,000 people could die or be infected, could die of this. I mean, that's a very grim tally, but nonetheless, has the Trump administration now has a change of mind over the last week about where they stand on the national lockdown?
We've certainly seen a somewhat change in dialogue when it comes to President Trump. He said just a few days ago that he was looking at the possibility of parts of the US economy opening up by Easter, so by the middle of April. However, the federal government has now extended social distancing measures across the country till at least the end of April. Now, the major physician, the major medical expert that's been one of the closest aides for President Trump during the COVID-19 coronavirus outbreak has been Dr. Anthony Fauci. Now, he has warned that according to the most dire of models that they're looking at, around 200,000 people in America could potentially lose their lives. President Trump himself says if efforts aren't taken into consideration and aren't mitigated, that between 100,000 and 200,000 people could die. So President Trump now seemingly very much grasping the severity of the situation. He's really appealing on the private sector, especially when it comes to car manufacturers, to switch tact, to start producing more ventilators at a rapid rate. He's saying that he's doing all he can to produce more PPE. Now, that's personal protective equipment for those fighting COVID-19 on the front lines. However, he has faced fierce criticism from many in the medical community and many governors in the US for not acting quickly enough to get those vital resources to those working in hospital and healthcare centres across the US. Of course, there are huge concerns that while New York is certainly seen as the epicenter of the coronavirus outbreak currently, the governor of the state, Andrew Cuomo, warns that New York is merely the canary in the coal mines, and what's currently happening in New York could very well happen elsewhere in the country in the coming weeks.
Right. William, thanks very much indeed for joining us with the latest of what's happening in America and how it's bracing for the weeks ahead, which don't look